Hello, everyone, and welcome to a new episode of the Caring Support Podcast. Here with me, as usual, my partner and the VP of Sales of our amazing platform, James Smith. Today, we have a great conversation for all of you. We're going to be talking to an RPN, a very successful one, I might add, Ashley Fox, who's here with us. Hello, Ashley, and thank you for joining us.
Hello, thank you for inviting me.
Great. So I'll just leave the floor to James, who's gonna be this amazing conversation.
Thanks, Laura. I appreciate it. Ashley, it's nice to see you again. How's
You
life
as well.
treating
Very well. It's healthcare is unpredictable, as you know, during the pandemic, but otherwise doing very well. How about yourself?
It's great. We're in the same boat where it's just nonstop, nonstop, nonstop. A lot of people showing interest in our platform, a lot of different things. I'm going to say it's somewhat still early, but it's just amazing the traction it's gaining. So there's a lot of stuff coming up. You know, we live by a roadmap, but we also have the nimbleness to respond to our clients' needs. Um, so let's get started because this is about you, and we want it to be about you and the value that you bring to the healthcare, which is great because I see how active you are on LinkedIn and other social platforms, which is fantastic. Obviously, you're always sharing other people's stories. You're always aware of what's going on, which is beautiful. So maybe for the sake of our audience, you could give us sort of a brief breakdown as to who you are, what got you to this point, and what makes you so awesome.
Oh, goodness, we'll be here for a bit. Well, my name is Ashley Fox. I'm a registered practical nurse. I work currently in home care, but my background was in retirement, long-term care, hospital, and dabbled a little bit in the addiction sector as well. Uh, what I do differently is I really do enjoy sharing other perspectives. I think we learn a lot more, not just from ourselves, but we learn more for our patient-centered care. We learn more about what other roles are. As we know, the sector is just very complex. There's a lot to learn, and if you're not in it, it's hard to imagine.
Yeah, agree, 100%. And I think that's really powerful because a lot of times I keep telling people one of the greatest assets we have is their ability to share a story. And what's really nice and what makes people feel amazing is when you take their story and say, wow, this really inspired me. And then you say, I can't help but feel compelled to share this with everybody else in my network because I think that they'll get tremendous value from it and it will inspire them by extension. So, yeah, I think that's amazing. So we got a few questions for you, as you probably know. So perhaps we'll start, from the top that sort of relates to the stories because this might encompass stories. But so with all your years of experience, apparently over 10 years, which is awesome, which are the biggest lessons you've learned, about succeeding as a healthcare worker?
Well, if I could go back in time, I'm sure my mom will disagree with me on this one, but I had to learn organization is key. It took me a while to get there. Um, I found that if I was writing notes, no matter what part of the sector I was working in, I would set myself up for success.
Hmm.
Because the sector varies so much, being able to have that little resource in your back pocket was fantastic. Um, the secondary part would be teamwork. Every team that I have worked with, uh, myself, I dabble in agency right now in home care. So I might go into a long-term care home. I might go into a retirement home that I haven't worked in. It's very intimidating, especially, there's team members, residents. There's a lot to know that those who work with those residents know like the back of their hand, right? They're able to pull out Mrs. So and so loves this drink at this meal, so and so likes their pills a specific way. I don't have that. So it's the teamwork is really important. And I've worked in a lot of homes where that is a huge benefit.
Hmm. Yeah, I can imagine the challenges behind that because very often some things are a level of comfort. And then it's the same as when you go in and you get to know the patients, clients, whatever that type of organization, and you're thinking to yourself, yeah, it would be nice to know that as well. But at the same time, what's amazing is you really are helping out these places by coming in and being able to look after when they're just so swamped, so burdened, and it's very hard for them to see the bigger picture half the time. So working in these different environments, such as long-term care, community home care, addiction and mental health, like you mentioned earlier, in hospitals, what is there any fundamentally, let's say, common traits or denominators, issues that affect healthcare workers, regardless of the environment they're in?
You know, it's funny, James, every role that I've worked in, no matter where it is in the sector, it's always come down to the ratio. So the number of patients to the number of staff. And
Right.
it's interesting because every healthcare employment would think they're unique in that perspective, and they're not. Right across the board, everyone has the same concerns. And I think that's just because there's so much differences in expectations from the care when you have a ratio that's higher and depending on the complexity of your clients.
Hmm. Yeah, well said. Interesting because, with caring support, we get a lot of that. And it's not just, let's say, the primary care, whether that's hospitals, hospice, long-term care, retirement, et cetera. We get calls from areas that go outside of that. So like the dental community, the physio, what have social work, child and youth workers, addiction, et cetera, all calling and saying, hey, is there any chance you guys are moving into our arena? Because we are desperate for people as well. And we have started to bring more of that on. We have roles that are like child and youth worker, mental health counselors and workers, physiotherapists, et cetera. So it's going to keep on expanding all the time. And with that, of course, we're doing what we can to try and help. But you're right, there is a staffing crisis. This is across the board. This is a new world we're in now where it's based on the candidate, and it makes it hard for healthcare organizations who've been doing the same thing all the time to suddenly have to change the way they see this, the way they interact, the way that they approach potential candidates or employees. Yeah, so that absolutely. So next question for you. What tools and strategies have you used in the past and maybe perhaps the present to overcome some of the issues that have either affected you personally or that you see in healthcare by extension?
One of the things I learned to do differently as a new grad is we learn in school, eliminate medical jargon, which as a new grad, you just learn medical jargon. It's fantastic. You want to use it all the time.
Right.
What I ended up having happen was I worked in a retirement community, and a resident that lived there called down to the station and said, I need you to come up and see me when you're able. And at the time, I was doing shift reports, so speaking to the previous shift so that they could get out, I could set up for my staffing and set up for my shift. And so I said to them, no problem, I'll be up as soon as we're finished report. What I didn't take into consideration was that they thought I was actually writing a physical report. So they thought I actually chose not to go see them because I was spending so much time writing this physical paper report. Um, it really drew attention to me that, yeah, we need to explain things on a better rationale to patients. I find that any of my patients that had different expectations or different views of the healthcare system, if you were able to sit down and actually explain to them, their perspective has changed.
Right.
They are a little bit more open to, okay, I recognize that Ashley's going to take a few minutes because she's doing this. They feel like they're part of that role and they feel empowered.
Hmm. That's very interesting. We just did another interview with a person that works in innovation in healthcare, and she sort of talked a lot about that, where it's more about the patient. It's not necessarily just having to advocate for themselves and try to get people to so they don't slip through the cracks, essentially. And now the concept says, you know what, it has to be centered around the patient. They're like singularly the most important part of the whole relationship. And very often healthcare has been about just, this is what's needed to be done, blah blah. And you never felt like you weren't like a stakeholder in that relationship, that you had a say that really mattered. So yeah, absolutely. And I mean, I know you're an amazing human being. So what's really great is I'm sure that you have those compassion and empathy and everything, because you want to understand where people are coming from and why it's so important that you take the time to understand and listen to them, which is amazing. So, you know, so what are the recommendations for other nurses, like yourself, and if they want to develop a career in healthcare and maybe even become, move into management, whether that's maybe initially supervisors, managers, et cetera. What would you say are some thoughts that you would share to help inspire others to when they're pursuing this journey or considering to pursue that journey?
The biggest thing I can recommend for anyone looking to get either into the medical field to start or even looking into those supervisory roles, as you said, never turn down an opportunity to learn. And that doesn't mean that you have to be taking continuing education courses all the time.
Right.
There's lots of opportunities to learn on the frontline level. Many nurses that I've spoken to, they always want to dabble in a specific field. You know, like I want to go into surgical, or I wanted to go into something specific. I find that the most success that I've had in my field is because I focus on being a jack of all trades. I'm not interested in going into a specific role in nursing. If it works out, then it works out. But otherwise, I like to learn everything that I can to be the best nurse that I can, and to help my patients. One of the things I found interesting was I had reached out to a new grad when I had a leadership opportunity. This new grad had been turned down for the opportunity. So she said to me, you know, what's different between you and I? And so I pointed out some continuing education opportunities that would really help her for a future role. um, she had never actually thought of it. She really was so focused on, you know, oh, these continuing education courses, they're so expensive, or I don't have the time. I really just don't have the ability to do them. And I don't think she really realized, you know, you don't have to go out and take a university degree. There's so much that you can learn from anyone, really. It doesn't have to be just the nurse. You can learn from your patient, you can learn from other interprofessionals.
Hmm. Yeah, very interesting. It's a daily thing, and it doesn't matter what industry, discipline, or whatever you work in. You know, I find myself that if I'm not learning something today, like when I look back on the day and say, well, what did I learn today that's going to make me a stronger, better person, more resilient? Or is it just a particular quality that I learned, or type of organizational skill and what it is that I do? And none of us is perfect, and we're not seeking perfection per se. We should be happy with who we are. It's just a matter about growth. And growth is an ongoing thing, which is great. And I'm lucky enough to work with a lot of superstars in our company at Caring Support, like the lovely Laura here. She's just fantastic in all the stuff she does in our marketing team. And and that every day just makes you realize that how lucky you are to have the people that are in your world, because you know that when they do certain things, whether it's manifest by their content they write, or that's something they do, or it's just a conversation you're having with them, it makes you, you really say, I have a sense of gratitude, and now I understand why. So let me ask you this, but what would be the single most important, I don't know if single most important, but how about I ask this? What what was one of the most inspirational things that transpired in your life when you were, either in getting into nursing or once you had become a nurse that you can think of?
The most inspirational, it's got to be any of the nurses that I've worked with, whether that was on a training purposes or whether that was just any employment that I've seeked along my career. Because many of them, and some of them are aware and some of them are not, they were a mentor. So they molded that nurse that was coming into the future. Whether they were aware of it or not is another story, but they all had some form of creating an Ashley, really.
Hmm. Yeah, because they have an impact in your life. They can
Absolutely.
often change your mindset. They can often make you reflect and say, wow, okay, I never thought of it that way. I know when I was talking about the caring support team, like Joseph, who's the president and CEO of the company, we've become very, very good friends, but I see him as a mentor many times, um, because of his incredible knowledge about business and what needs to be done next. And we share ideas all the time, but what I love about it is the fact that every time I'm around him, I kind of I chuckle about it with them, but I say, "Wow, man, I really appreciate this person's brain. It's amazing the stuff this guy thinks of." Um, but when you were talking about students earlier, and you probably seen or knew about the fact that the academia channel on caring support is really cool, because what it does, right, is that is whether it's the practicum, internships, placements, or full on employment as a grad or whatever. It's amazing how post-secondary institutions that have health science can take all their students that are already on the platform, see them and be able to champion them, cheerlead for them, and then send these right to healthcare organizations and say, hey, blah 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 blah. I don't know any student that would say, no, I don't want you to do that for me. You know what I mean? Because let's be honest, a lot of times in that whole interview process, our confidence is like, especially when we're new to the industry. So I think what we try to do when it comes to connecting people is I say to them, try to see more than a job platform. try to realize that this is like networking. This is like starting to build a community, an omni-channel concept with, you know, candidate, school, and the healthcare organization. And there's so much more to come. So it's very exciting for us as well. But, you know, it's really amazing to work and with people like you, Ashley, to have, you know, you as part of what we're trying to accomplish, and us to promote you and to make sure people understand what makes you so amazing. You know, you have a great attitude, which is always, always welcome uh, and wonderful. So when it comes to sharing content on social media, you do this a lot, which is great. And everything I read, I go, that's really amazing. And probably I should, more than just like or support your comments, maybe I should start sharing some more of them more than I do. But let me ask you something. If, from your perspective as a nurse, I know a lot of people, they just read stuff, but your way of engaging on social media is great. What makes you do that in that way? Is it just that you want to share stuff, or is there something else there?
I think part of it is, and you've kind of hit the nail on the head before, is, you know, you can read things, you can interpret things, but
Hmm.
you really have to give that voice back to someone else. And if, you know, it's kind of like a light bulb moment. I'm reading something going, you know what, that is fantastic. I never thought of that before, whether it's patient care, or I follow quite a few nurses who have branched out into different employment roles, become entrepreneurs, etc. Um, and part of me just wants to share their voice. You know, there's a lot of people out there that don't take the time to absorb. We're all really bad for that, right? I mean, we're flicking through our phones, we're flicking through the channels. We don't really pause and actually interpret that information. So if I can give that person a voice across my platform,
Yeah.
I've always said, across a few platforms that I exist on, like, if you have something you want to say, whether it's anonymous or you want it amplified, let me know. I'm happy to share. Mhm.
Yeah. So let me ask you this: where are people going to find you, Ashley? What social channels are you on?
Best two to find me on is LinkedIn and Twitter.
Perfect. Yeah, I'm not much of a Twitter guy, but I live on LinkedIn, no question. And that's how I first connected with you. Um,
Hmm.
so yeah, that pretty well, you know, is most of the questions that we wanted to know really about things, Ashley. And you're welcome to share anything with us before we let you go, if you prefer. Is there anything else that you can think of that you would think is very important to share with our audience?
I think just reemphasizing what you had said before about the mentorship and the networking. So often as a new grad, we're intimidated, right? It's a big world, finding employment, finding the right employment, that we don't think about those people that we do network. You know, they will come back. It's just a matter of when, where. Sometimes it's an employment opportunity you didn't think of. And sometimes, like you and Joseph, it's another friendship. So,
Hmm.
mhm.
Yeah, absolutely. So I want to thank you so much. I know you've been like super, super busy. Things are hectic, and you know, so it's really great that we're able to do this today because I've enjoyed, you know, what you've had to say, and you know, and it's awesome because you see, what I'm going to do is I'm going to actually to a networking event later, and then I'm going to say, hey, guess which rock star we talked to today, and then and I'll be telling them all about you. So thank you so much, and thank you, Laura, for setting this up. Certainly appreciate it. She's pretty diligent, isn't she?
I was going to say thank you to both of you. I can only imagine the behind the scenes to set it up.
Yeah, sure.
Yeah, we really appreciate your time and your knowledge. I'm pretty sure lots of nurses and nurses to be that will listen to this will really learn a lot from you and from your decade of experience in nursing. So thank you.
Yeah.
Thank you both.
Thank you.